Hi, my name is Becky, and I'm an RN, registered nurse with Gritman Medical Center, and I typically work with quite a few orthopedic patients that come in. The day of the surgery, you're met with our CRNAs. They're the anesthesiologists who are going to be working with our physicians for your care, and they administer a block to the muscle of the operative site so that it will be an adjunct in pain control through the night and into the next day. Post-op, you are brought from PACU to the med-surg wing and introduced to one of our registered nurses, I'm one of them, and our CNAs. We greet you at the bedside and begin that transitional care from PACU and the operative area to transition to med-surg care. Physical therapy then will come into the room later in the afternoon and introduce themselves and give an idea of when the therapy session will begin. Typically we have people up and in chairs for dinner, and there is also a first session of physical therapy walking in the room and in the hall if possible. The benefit to staying overnight in our facility is that you have a physical therapy session in the evening and also the next morning prior to going home. And we also encourage a family member to come in and be a part of that physical therapy session because two heads are better than one, and they can also be part of a pep team for that patient when they're doing their exercises towards recovery. Doing our part for the opioid crisis, we utilize pain medication modalities using anti-inflammatories as our main pain control. We understand that it's not going to take care of all pain, but we do utilize it because it goes to the source of the tissue pain and inflammation, so we utilize them heavily. We also have the narcotics, the opioids, that we do use sparingly, but to control your pain. We prefer to have a pain level manageable and comfortable for a patient. Our food is of great service. There's nothing like when you haven't eaten for 12 hours, you're NPO, and you come in and you're starving, and you're given a choice of a gourmet breakfast, lunch, or dinner. So I just enjoy playing playfully with them, conversing and talking about especially how far medicine has come. I've been a nurse since the 70s, and I can let them know stories of what I've seen in the past and what we have now, and our technology is far superior. This is a wonderful time to be a patient, either on the medical floor or surgical floor. I've had many patients say that they put it off for a year or two with bone on bone from arthritis, and they decided to go ahead and try it. And coming out of surgery, and already they're experiencing a lower level of pain. And even the next day with the PT and such, it's less pain than what they were living in the year before, and so they're very grateful they had the courage to go through with it. It's just wonderful to see people going forward with hope, and they're going to be walking again. Some of them are hikers, runners. We're giving people in their 60s, 70s another chance at 20 years of viable living. That's what's very positive about this. The surgery is worth it. People are living longer. We have wonderful medicine, wonderful techniques, so trust. Go ahead and have that joint replacement. It will give you longer, a happier, viable life.